are going to start our CME year right. And how are we going to do that? We are going to do that because we are going to give you vital information so that you can be your best at work and that you can be your very best at home for yourself as well as your family. This morning, our speaker is no stranger to us. She wears multiple hats, and I'm sure you would have seen her or heard her in some forum. But for those of you who may not know, allow me to introduce our speaker for this morning. Dr. SABRIQUET Pinder-Butler is presently Chief of Services in the Department of Family Medicine at Public Hospitals Authority, having been employed by the Princess Margaret Hospital, PHA, since July 2003, after completion of her MBBS from the University of the West Indies, St. Augustine's, Trinidad. She is also engaged in comprehensive family practice care at a private office at the New Horizon Medical Clinic. She completed her postgraduate studies at the UWI School of Clinical Medicine and Research, obtaining an MSc with distinction in family medicine in 2008 and a Doctor of Medicine in Family Medicine in 2010. She has a Bachelor's of Science in Chemistry Pre-Medicine from Florida A&M University and an Associate of Science in Biology with Chemistry from the College of the Bahamas. She is a proud high school graduate of Jordan Prince William High School. She serves as a lecturer at the UWI SCMR, the Bahamas, and is the coordinator of the Family Medicine Residency Program. She has been a part of the research committee at the UWI SCMR Bahamas and serves as research supervisor and advisor to medical students and postgraduate students. She has published research papers and have been involved in several research papers that have been presented locally as well as regionally. She previously served as the Caribbean lead for the Wonka Working Party on Women and Family Medicine. She has served as vice president of the Caribbean College of Family Physicians and was chair of the accreditation committee. She also served as president of the Bahamas Association of Primary Care Physicians. She is the outgoing president of the Consultant Physician Staff Association in the Bahamas. She has served on several national committees in the Bahamas and is involved in numerous community activities. She is a Justice of the Peace in the Commonwealth of the Bahamas, and she serves on the Medical Appeal Board, the National Insurance Board of the Bahamas, and served as a member of the Disciplinary Committee for the Bahamas Real Estate Association. Her special interests are in chronic non-communicable diseases, medical education, and also work-life balance. She is a proud Bahamian with roots in Sandy Point, Abaco, and she has a very large and supportive family. She is the second child of Bishop Carrington and Dr. Sabrina Pinder. She is also the very, very proud mother of two daughters, Chanel and Anna. She's an active member and organist in the St. Mark's Native Baptist Church. So like I said, I'm sure you would know her from one of the many, many hats that she wears. So without further ado, Please welcome Dr. SABRIQUET Pinder-Butler presenting to us this morning on work-life balance. Dr. Pinder-Butler?
Good morning, everybody. And thank you for inviting me to be a part of this CME this morning. Can you just confirm for me that you are seeing my slides and that you're able to hear me properly?
Yes, you are good to go.
All right, wonderful. So I certainly I'm very delighted to be here at the start of the CME year. And I think that this topic of work-life balance is certainly one that all of us should look at, especially at the beginning of the year, just so that we can get ourselves refreshed and restart as we take on all of the various tasks that we will be presented to us as we go through 2025. And certainly, work life balance is a topic that is very near and dear to my heart. And so I'm very delighted that I've been given the opportunity to share some of what I've learned over the years with you this morning. And so, welcome again to all that are here with us today. I have no financial disclosures or conflicts of interest. And just so that we are clear with some of our objectives for this presentation this morning, we're going to firstly review the concept of work-life balance. We're going to discuss challenges with work-life balance. And then lastly, we will discuss ways to improve work-life balance. Because at the end of the day, I think even though we know that there may be challenges, one of the most important things that we need to remember is looking at ways to make things better. And so just to make sure that all of us have a good understanding of what work-life balance means, because not all the time I think we talk about this topic, I think that it's important for us to have that footing first. And so I like to oftentimes use dictionaries to give us clarity of thought on just some basic definitions. And so Cambridge actually defined work-life balance as the amount of time you spend doing your job compared with the amount of time you spend with your family and doing things that you enjoy, which sounds simplistic enough, but sometimes that may not be the case. When I actually reflect on the word balance and even, think of things that remind me of balance, one of the first things that comes to my mind is oftentimes a balance beam. And I think most of us have probably seen even gymnasts that are on these beams and balancing, and sometimes how that can look tricky for them. And interestingly enough, the Oxford Dictionary has two definitions for balance because we know that it can be a verb and we also know that it can be a noun. And so, as a noun, balance is a situation in which different elements are equal or in the correct proportions. And I want us to pay special attention to these definitions because they will become probably a little bit clearer as we get further in the talk. And as a verb, balance is when we put something in a steady position so that it does not fall. When we put something in a steady position so that it does not fall. The diagram to your right or on my right actually allows us to look at the various domains and things that we can be involved with, not just work. Even when we look at various domains in our life, we know that that can consist of relationships that we have with our family members, relationships with our friends, our health, our spirituality. Certainly, I know in the Bahamas, we're very religious, things that we do for fun. And certainly that can vary for all of us. I like to dance, I like to play music, other people may enjoy reading. Our finances is also an important aspect of our life, and certainly our work. And so Kirchmeier in 2000 actually defined and thought that work-life balance was the achievement of fulfilling experiences in different aspects of life that require various resources. And these resources should not be uncommon to us. Energy. We know that we always need energy to get things done. Time, which is also a necessity, and commitment, which spread across all the domains. Chang et al. In 2010 actually had a slightly different perspective, although important, on work-life balance. And they referred to work-life balance as an individual's perception, and again, highlighting and focusing on the individual's perception of harmony or equilibrium between work and life domains where there's low conflict. And in this instance, conflict refers to competing factors. So competition between work and what we do in other things in our life, or high satisfaction in both work and life domains. And I think, this is a very important point, even when I reflected on it and came across this concept, because oftentimes we know that what we may perceive may not necessarily be what is our reality. And certainly before I started or I became invested in work-life balance, I thought I had an excellent work-life balance, or I did very well. And maybe that was because I thoroughly enjoyed my job and had high satisfaction with that. And yes, I was involved in the various activities, as was mentioned by Dr. Wallace Bain, and I thought I was doing a good job in those areas. But when I actually reflected on the balance of it, there was certainly a tipping of the beam, and perhaps the beam was tipping more to the side of work. And so at the time, my perception was not that that was the case. But as I reflect now, I can see that there certainly were times, and sometimes are times, when there are competing and low conflict or higher conflict with my work and life domains. And so it is important for us when we talk about work-life balance to appreciate that there are two key elements, and those are job satisfaction and life happiness. And of course, when we talk about happiness, these are things that bring us joy, things that make us laugh, things that put us in a place of contentment. And so these are the two key elements of work-life balance. So this brings me to the question, and I'm not sure if I'll be able to see in the chat group, so maybe Dr. Wallace Bain might need to keep an eye out for me. But if you can just tell me or put in the chat, when do you think work-life balance was first proposed? Was it the 21st century, the 20th century, 19th century, 18th century?
We have a response for the 20th century from Melissa Burrows.
All right, so we have a 20th century.
We have a 21st.
I'm sure we'll have some prizes and surprises at some point.
Absolutely. We have D, which is the 18th, 21st, the 20th.
All right. So let's see what the winner century is. All right. So work-life balance actually began in the 19th century, where workers campaigned in various countries in the United States as well as in the United Kingdom against long working hours in the factories. And they actually were demanding 8 hours. I don't know if many of you heard the slogan, 8 hours to work, 8 hours to rest, and 8 hours to do whatever you will, but that's what they were campaigning for. And at that time, it was because workers were working on average between 10 to 16 hours a day. And so it was very important for them, and certainly they realized the importance at that time of spending time with their families, spending time to rest, and certainly spending time to do other things that they enjoyed. As we continue to have more workers agitating for industrial revolution. Many campaigns continued throughout various countries. And in the early 20th century, there were campaigns for maximum hours of work. And that's where we get the 40-hour work week from. So we have people who were fighting hard for this for us. And many countries pass laws, including the Bahamas. We also have laws that speak to 40-hour work week. However, when we look at certainly what's happening in many industries, and especially in healthcare, we know and studies consistently show that healthcare workers have increasingly longer hours. Now, we also can appreciate that that may be due to staffing shortages, persons sometimes needing more financial assistance, because we know that finances are also an important element of our lives. But there are various reasons why healthcare workers in particular have increasingly longer hours. And even the demand with our patients, and in some instances, the training that we all may go through, these are also contributing factors to why we have increasingly longer hours of work. Studies throughout the United States, as well as when we look at global trends, continue to show us that even for physicians, the average working hours are more than 50 hours per week, with a quarter of physicians working between 60 and 80 hours per week. And we also know that when persons work more than 51 hours in particular, and the research is clear, this increases our risk for depression, increases our risk for anxiety, and certainly increases our risk for burnout. So, what are some of the challenges with work-life balance? We know, and I think most of us come into healthcare because we want to care for patients, we want to provide the best healthcare that we can throughout the country. But we do know, and if we're being honest, that our careers generally demand a selfless emphasis on caring for one's patients. And just by that very nature, that in itself can pose a challenge. You cannot leave the patients in many instances because they may be very ill. And so even though you may need to do other things, your focus is on caring for that patient. And sometimes that's at the cost or the sacrifice of our family life, of our time that we're able to rest. Even when we're going home, we're thinking about things that we can do for the patients. We're preparing for the next day. Even persons in administration, because there's so many things that need to happen. And so just our career alone is a challenge to work-life balance. We also have to consider and look at the shift in family dynamics. Yes, we know in times gone by, generally, the women in particular were at home, taking care and building the family, and the father or the man was at work. But now we know that in most homes, in most families, both parents are at work. And we also have a lot of single family homes, and grandparents are working. In times past, the grandparent, or the grandmother would be at home. The kids would spend the summer and different times with the grandparents, but now everybody is working. And so the support that used to be available perhaps in times gone by is not like it was in our present day circumstances. And we also know, as much as technology and mobile devices in particular, even our laptops and other things have been found to help with productivity at work, studies have shown, Palvia and Brown did an interesting study where they actually found that mobile devices and technology can actually be a threat to work-life balance. And this is the case because we find that oftentimes, and I'm sure I'm not the only guilty one, our phones are always with us. When you're trying to turn off from work, you're unable to because the messages are coming through constantly. And once they come, even if you try to ignore it, your subconscious still is going. And so you're always in work mode. It's never really off. And so technology we see is a work-life balance threat. Sometimes it is difficult to strike a balance between work and other domains. And so we have to be honest about that. Even though we would like to promote healthy work-life balance, there are times that it will be difficult. And certainly we know that depending on the various stages in our life, work-life balance may be easier to attain than others. Yes, when you're in studies and you have timelines. You may also be working as you're studying, and then you have to balance that with the family life and the other civic groups that you may be a part of. It may be very, very difficult for you or some of us to handle those things, and sometimes it can be overwhelming. Additionally, especially when we look at our healthcare system, especially hospital workers, we know that sometimes our shifts can be overburdened, whether it's with patients, whether it's that we're faced with challenges with staffing, shortage supplies, all of the things that I know that we perhaps in healthcare have seen. There are times when that overburdening on healthcare workers can have a significant impact. It can have an impact on our family time because we're not able to spend the time that we would like to because we're so busy putting in all those hours. And then by the time as we get home, we're so tired, we're drained, our energy levels are extremely low. And we know as healthcare providers that these circumstances lead to weakened immune systems, perhaps, and may put us at risk for having a negative impact on our health. And certainly when that happens, this will further compound issues with work productivity. And so this is also a significant challenge with work-life balance. In fact, the Journal of General Internal Medicine in 2023 found that overloaded healthcare workers are twice as likely to leave their jobs. And so this is something that we really, really have to think about. We cannot also neglect the impact that COVID-19 had on work-life balance challenges and stressors. We know that there was an increased risk of anxiety, depression, and burnout in healthcare workers in general. Many of us were fearful of the unknown. Many of us had to work. And I know at one point, I think we even had slogans, we have to come to work when everyone else was at home because we were taking care of the patients. But even during this time, we know that we lost colleagues, we lost loved ones. In some instances, especially at the beginning of COVID, we were still trying to figure so many things out that just the mental exhaustion was a lot on healthcare workers in general. And so we cannot over emphasize, and even now we know that the impact of COVID still carries on through today. And there was an interesting study done at the University of Texas that what they found through their faculty, especially in women, is that after COVID settled, half of the women faculty wanted to leave their jobs or to reduce their hours. And there was also a decline, 60% of them declined leadership roles. And this was because they were exhausted. They did not want to take on anything else. In some instances, the impact of COVID allowed them to reflect on other things that became more important to them in other life domains. And so sometimes this can certainly be a significant work-life balance challenge. I would be remiss if we do not also speak to women in healthcare. And we know that in general, women make a significant portion of the workforce. This is perhaps through all industries. We're having more women pilots, we're having women, even I remembered years ago, I never saw a woman gas attendant, but women gas attendants. So women are not in the home anymore as the homemakers, as we know. And so certainly healthcare is no different. And so we've seen a dramatic increase in women in medicine across all specialties in general. But this cartoon picture that I am displaying, when I saw it, I also I reminded me of a time in my life as well when you're busy at home trying to get ready for work, but you're also taking care of the children or the baby and thinking about trying to get to school, trying to all of the duties that you may have to have after that, trying to prepare a meal. Because unfortunately, even though we know that women have achieved great success in our careers, our responsibilities in other areas have not been reduced. And that in itself is a significant challenge. And so studies consistently show that work-life balance can sometimes be more challenging for women than for men. And we also know that women sometimes may have challenges in the healthcare system related to gender biases and sometimes lack of support. When we talk about the importance of prioritizing work-life balance, because despite there being challenges, despite there being things that we know may impact it, we also appreciate the importance of having or trying to achieve a healthy work-life balance. And so naturally so, when we look at even choosing our careers, especially in healthcare, we know that women in particular prioritize work-life balance significantly more than men. And this impacts career choices across the board. Studies have also shown, and I know a lot of times we talk about the generational gap, and sometimes we try to evaluate why younger persons may think and do things differently than some of us that may be older, and even persons that may be elderly may consider that as well too. Why are we thinking so differently and wanting to do things differently? And yes, studies support that a lot of our older generation healthcare workers, they considered working as their number one priority. That in some instances was considered a staple of success, how much you work, how much you get done. Your accomplishments in life were oftentimes linked to your careers and how much time you spent at work. And I think even sometimes now when we listen throughout social media, a lot of times we hear a lot of persons highlighting success related to how much you work. There's a big push now that you need to have more than one income potential, and so you need to do more things. So it's not uncommon, but that happens. However, the studies have shown that the millennials, as well as the Gen Z generation, so that's our 13 through 44-year-olds, they prioritize work-life balance. They don't necessarily want to be working 50 plus hours a week. They want to um, make time for their hair and their nails. They want to travel. They want to go to the beach. They want to do other things, but they are going to work as well. But their their importance with work has to do more with having a career that allows for more flexibility and more fluidity. There was a study as well that was done by the American Medical Association in 2017 that looked at physicians on 35 years and younger. And they found that more than 90% of them thought it was important to strike a balance between work, personal, and family responsibilities. And at that time, 65% of them, which is a good percentage, felt that it was achieved. And so we know, sometimes I recall when I started medical school and was going through the halls of PMH and reflecting on the amount of hours that we would need to put into work, because I think prior to that time, most of us never realized that certainly for internship, we would be there more than 24 hours. We did not realize the amount of time that we spent with work, even for our nursing colleagues that perhaps worked multiple shifts because of staff shortages. We did not realize that this was the amount of time that we would be putting in at our workplace. And some of the things, perhaps, as we look over what it is that we do and reflect at some of the important elements of work-life balance, we know that perhaps this is why there have also been some changes in terms of the hours that persons are allowed to work, because we know that challenges can happen, errors can happen when people are burnt out. And some may even argue, do we really need to be there all of those hours? How much can you really retain when you're tired? So just things for us to think about. I also included this slide as well because I wanted us to see some of the benefits, which would be some of the things in the blue, the good things that can result from a good work-life balance, not just for us as individual healthcare workers, but also for our healthcare institution as well. And then some of the things that can happen when we don't have a good work-life balance. And so would be some of the poor or the negative outcomes. And so we know that studies consistently show that good work-life balance will improve our mental and physical health, can allow us to strengthen personal relationships, will allow us to have more creative and productive employees. And I think that's extremely important. We want to be creative and productive, and we have to be, especially in our healthcare system where we have challenges, even from a financial standpoint, ways to make things differently. Those things can happen if your employees have a good work-life balance. Higher job satisfaction, for example, that's extremely important. And sometimes it's not always about the pay. I'm certain that in some of the studies as well, they found that salary was important. While salary is important to healthcare workers, that job satisfaction can occur from other things, good community feeling at work, good work environment that promotes work-life balance. So those things are important and extremely critical because we know that we have challenges, for example, with nursing staff shortages across the globe. This is a global challenge. We're even finding that we have a global challenge with physicians, and some predict that by 2033, we will not be able to have enough physicians to care for persons in various countries. So we need to make sure that we're inculcating a spirit of good work-life balance so that we can have increased employee retention. And then when we look at the flip side, some of the negative things, burnout, which we know, absenteeism, because when you're burnt out, you're not going to come to work. Reduced engagement, you cannot be connected as connected or engaged as you can be when you are tired, when you have poor work-life balance. And that also will lead to a high turnover rate. So I want us to just take a few minutes to do a bit of self-reflection. For those of you that have a pen and paper nearby, take it out. For those of you that don't, I will read off some of the questions so that you can reflect on this as well. And certainly I will include and have included the site from which I sourced this quiz. And so I've given this talk a few times, and every time I prepare for a different group, I try to look at different things that I think are important to look at. And this particular quiz uh, allows us to look at 5 different areas of our life in general. And one is our work. Another area has to do with our personal life or our family, nutrition, as well as our goals. And so each area has 5 statements. And so I want you to, as I read the statement, and I don't want you to cheat because, sometimes I think I've cheated even when I did this quiz a few times before, because it's something that you can do repeatedly just to see where you are with your work-life balance, and then to reflect and to help you make changes. So it's not punitive at all. It's just to help us grow. And so we don't want you to change whatever's your first thought. When you do those multiple choice questions, one of the keys they say is whatever answer comes to you first, that's the one that you put. So that's the one that I want you to give. And so you're going to give ratings between 1 through 5, where 1 means you completely disagree, 5, you completely agree, 3 in the middle, you agree, and then 2 and 4, you mostly either disagree or you mostly agree. So we're going to start with work or career. Let me know if you're following me in the chat. Put a thumbs up. Marilyn, I may need you to monitor the chat for me, please. All right, good. And so the range is also on the slides for those that are able to see them, okay? So the first one, and I remembered when my kids heard me reading out this statement, they felt that they could answer this, right? I rarely bring my work home with me. For me, that was a 2, mostly disagree, because that is an area that I struggle with. But it's okay, because we know that it's also about improvement. And some of us may rarely bring our work home with us, and you may completely agree with that. I feel productive when I finish work on most days. How many of us feel productive when we finish work on most days? Right? So if you completely agree, that would be a 5. If you mostly agree, a 4. And if you completely disagree, which I hope most of us don't, that would be a 1. But again, this is to help gauge you to see where you fall. I am making the income I feel I deserve at this point in my career. And I remembered when I read this off at another group, I got a lot of noises that day. And so that is definitely one that I know that will be interesting for all of us when we look at our scores. I work hard enough while also knowing when to stop working. Now, I definitely know I struggled with this. I'm an overworker. I know that that's something that I work on all the time, right? But it's a work in progress. I've certainly improved from when this whole work-life balance journey started. I enjoy what I do for work most of the time. So for me, that was never a challenge. I've been a consistent 5. But again, for some that may be a 2 or a 1. But again, it's to show us the areas that we may want to improve on that will help us to have a good work-life balance. Our goals or achievements. All right, I accomplish most of the tasks I have due each day, week, or month. How many of us are able to set goals for ourselves that excite us and are achievable? Okay, very important. I see myself moving towards my future goals. So do you agree completely that you're moving towards, or you can see yourself moving towards your future goals? Or is that an area that's a 1 for you? All right, good. I feel a general sense of satisfaction and happiness with my life. Again, we're talking about life happiness and job satisfaction. Do most of us completely agree, mostly agree, 4 or 5? Or do we agree? How are you feeling? I set realistic goals for myself and my work and personal lives. And again, as I said, pick the first thing that comes to your mind. Don't try to reevaluate it too much because, again, this is a work in progress. All right, when we look at our personal or self, I am able to handle stress and rest or relax when I need to. I know that sometimes we have different times when our stress level may be up, and so this may change. This range or things that we agree to, this may change depending on the time in our life and what's happening at work, what's happening at home. All of these things may change. Our house is clean and or organized to my liking. Would you agree? And what level of agreement would you give that? I have a good amount of interests or hobbies outside of my work. I remembered in another group where I shared this, there were some persons who said to me, hobbies, what are those? How am I supposed to find time to do those things? Again, that would be an area that you would be able to identify and improve on. I take holidays on a consistent basis and use sick days when needed. Now, I know that in healthcare, we would think that we would, use our holidays and sick days when we need it. But sometimes I know this is a struggle. Some of us may feel guilty about taking the time that we need, but we have to keep that in mind. So, how would you rate yourself with that? And I take sufficient care of my physical and mental well-being. You would think that most of us would get a completely agree, right, as healthcare workers. But I know that that's not the case. For me, certainly, that's an area that I definitely sometimes need some help with. But it's good for us to see where we fall. All right, good. So I'm seeing quite a bit of a balance between 1 through 4 in that area as well.
That right there, number 10.
All right.
Corona.
Our family and social. I have a good number of supportive friends and or family. Would you completely agree? I spend as much time as I would like to spend with my friends and or family. I am able to unplug from my phone, tablet, or computer during my family time. Again, as I said, for me, this is something that I struggle with. So I I am probably an agree now because I've put some things in place to change that, but certainly I was a 1 not too long ago. I care for others a fair and realistic amount. And I leave social gatherings feeling good about myself. Now, that was a 5 for me consistently because I always like to have a good time. So I hope you guys are putting in those numbers and keeping them so that you can reflect on that as well. And our last area is nutrition or exercise. Now, I'm sure because we're all in healthcare, we expect that everybody's going to have a 5. I exercise or do something active at least 3 times per week. I eat healthy most of the time and eat consistent portions. I do not drink or smoke to excess and do not use drugs. I see a doctor when needed and get regular checkups. So the same thing we advise patients, are we doing those things? Where are we falling? And I try to maintain a generally healthy lifestyle and make improvements to my diet or exercise routine when needed. Okay, so yes, I know that some of us struggle in these areas. Sometimes I certainly do and need significant improvement, but it's again to help us all to look to see where we fall and to see what things we can do better. And so I'll keep your scores if you have them. We will talk about this at the end of the presentation, but keep the scores as I think it's good for us to all know where we are. So what are some of the ways to improve our work-life balance? So I'm sure from some of the things that you saw in that quiz alone, we probably all could identify things that we need to improve. The first thing is for us to always reflect on what our purpose is. Know what your purpose is in life. Know what your purpose is for all of the domains in your life. What are the goals that you want to achieve? And write them down, keep them clear. Because if you don't know what they are, you will struggle with trying to achieve a healthy work-life balance. Time management. We can never get time back. I think we all know that. And so, yes, the 24 hours in the day that you have, it's important for us to make sure we are maximizing them. Use things that can help us maximize our time, schedules, diaries, timers, all of these things are available to us, but maximize your time. You're going to need to, especially when you want to achieve a healthy and a good work-life balance, because that's the only way for us to see and to know and to help us map out the time that we have. I think most of us are surprised that we're already at the 31st of January, right? That's how quickly time goes. So you have to manage your time. Prioritize and be intentional. There are always going to be so many things that need our attention, and sometimes those things will change, but you have to put things in order of priority. What needs to happen now? What can wait until tomorrow? What things do I need to do? Yes, I want to have a lunch date with a special loved one or friend. Schedule it out, because if you don't schedule it out, I'm sure all of us know every time you see a particular friend, oh, we have to get together, oh, we have to do this. And guess what? It doesn't happen because we don't set the time. Similar things that we may need to do even in our homes. We need to get things done. You may need to do some work. We always say it, but if we don't set times and be intentional about it, it will never happen. Or if it happens by chance, that's less likely. Set boundaries. Now, I know that sometimes this may be a challenge, especially for work, but you have to set boundaries. You have to be able to say, I'm at home. I'm not able to take certain calls. I'm not able to review certain things, because otherwise everything can merge into all of your other domains, even with other things that we like to do, whether it's church, whether it's things with our families. We have to set boundaries, because otherwise, even it may be difficult. And I know some persons see things as conflicts or have a fear of telling people no. But sometimes it's okay to say no, right? I had to learn that as well. It's okay to say no. I'm unable to do something. Refer to someone else if you can help. It's okay, because you want to try to have a balance. And so that's very important. Flexible schedules in the workplace have also been found to be good with improving work-life balance, and consistent studies show that. Certainly, we know that if you're able to adjust certain things, and that's not always the case depending on where you may work, but we know that studies show that environments and institutions that support that allow for more productive workers and a more productive workforce. Prioritize wellness. Wellness is extremely important. We work in healthcare. Yes, we may think that because of that by right, that means we know what we need to do, but some of us are still not prioritizing that. We do only have one life to live. That's not just a saying, it is the truth. And so if we don't take care of our bodies, our minds, our spirits, our spiritual life, this can impact us significantly. Again, planning vacation. Get that downtime in. It's extremely important. That is why you have vacation. I know sometimes some of us, it seems like, we just have the vacation for it to carry over. That's not the purpose of vacation. And so let's encourage our staff and the people that we work with to take leave to get that break that they deserve. Asking for help. None of us can do things on our own, especially when we have so many domains in our life without asking for help at different times. Sometimes we may need guidance or how to do things best, how to maximize our time. And so it's good to make sure that we have good relationships. It's good to ensure that we have people that we can ask for help. It's good to make sure that we have a good spiritual life, because sometimes our help will have to come from God in certain situations. And we will need to be able to call on Him, especially in times of need. So it's very important in allowing us to improve our work-life balance. Practicing self-compassion. Give yourself some grace, okay? Sometimes we are our hardest critic. I know sometimes I am on myself. It's okay if you're not able to get everything done. Tomorrow, God's willing, you will be able to tackle it. It's okay if you failed at something that you would have liked to achieve. Tomorrow you will try again, right? But we have to be able to be kind to ourselves. We have to be able to know that it's okay to not always have things 100% or to achieve what we wanted to do. It's okay. And then, if that work-life balance experience becomes, and life sometimes becomes a bit overwhelming, you may have challenges with your family. Someone may be ill. Your children may be sick. Work has a lot of stressors. All of these things happening at once. It's almost like the saying we like to say, when it rains, it pours. We all know that sometimes that can happen. That's okay. Just reanalyze and reset. We have to start looking back at, whether we need to look back at our purpose, reset our goals, reprioritizing. It's okay to reanalyze and to reset. But the important thing is not to allow things to just continue without trying to have a good work-life balance. And so in summary, a healthy balance between personal and professional lives is essential. Okay, it's not something that we can take for granted. It is essential. Because we're all individuals, there is no standard work-life balance that fits a one-size-all-cap. And because life dynamics change, our careers may change, our family circumstances may change, our finances may change, this too tells us that our work-life balance status may change. So things are fluid and it's personal. A healthy work-life balance may be difficult at times, but be encouraged because it is achievable. Good work-life balance will reduce stress. It will reduce burnout, and it will improve our well-being. So let us increase good work-life balance awareness. Let's make today count. John Maxwell reminds us in his book, New York Times bestseller, Make Today Count. Excellent book that I think I'd recommend that everyone reads. But while we're making today count, let's all practice ways to improve work-life balance so that we can be happy and enjoy life happiness as well as job satisfaction. These are my references, and I thank you.
Thank you, thank you, thank you so much, Dr. Pinder-Butler. It was a wonderful presentation. I told you guys it was going to be good. I hope that you had your pens and pencils out. I hope that you were making your notes. I absolutely did. And Dr. Pinda Butler, I waiting to know what my score mean. I still trying to, I was there.
So
I
I
did my
will tell you, I
calculation.
will tell you, because
Yes,
I want
please.
to make sure that you get your score. So I was glad that I stumbled across this as I was looking through, because it's always good to learn more as you are interested in various areas. And so I'll just give the breakdown for persons who want to know. If your score is between 85 to 125, it means that you have a pretty well balanced life. So your work life balance is pretty good. So continue to maintain that happy, well minded lifestyle. But also look at the areas individually to see if there are any threes or twos or ones, because those would be areas that you would still want to improve on. Okay. If your score is between 42 to 84, you're not doing too bad. So that's a fairly good work-life balance. But again, you can improve in the areas that are below a 3, certainly. And then if your score is 41 and below, and sometimes that happens, as I said, I think it's good to do this periodically. Because it means that we need a little bit more help. You need a little bit more support. The work-life balance is not as good as it should be. But, don't be discouraged. That's why we're talking about ways to improve that work-life balance so you can know how to better enjoy all of the areas of your life.
Okay, thank you. Well, I'm happy to report I'm not in the low category, but I do have some work to do in some other areas. So I hope that you all were able to record your score, go back and do it if you didn't get an opportunity to. It's a good way to do self-reflection to improve yourself, and this is what we want for you. So our chat is buzzing. It is definitely buzzing. So we'll swing over there and see what's happening. Very important CME. Thank you, Dr. Pinda Butler. That is from Dr. Calais Philippe. Dr. Holder, timely, relevant topic. R. Carter. Guys, can we get you to put your full name? It's going to be very important for when we put our paperwork together for the consult. I would appreciate that so much. R. Carter says, very informative, excellent presentation, Dr. Pinda Butler. Clap, clap. Dr. Hall said, loved it. Dr. Kayshawn Wilkinson, timely presentation. Thank you. And I would like to congratulate Dr. Kayshawn Wilkinson for getting the trivia question correct. It was the 19th century. Dr. Wilkinson, you could see me for your prize. Dr. Hall again said, truly enriching. Dr. Burrows, multiple applause for you. Very timely again from Dr. Hall. Dr. Darling, thoroughly enjoyed this. Dr. Bassett, can we get the link to the questionnaire? Can that be posted,
Absolutely.
please? Great talk. Yes, Dr. Pinda Butler will sort that out for us. I think, okay, this is Nurse McKinsey. Very informative and timely presentation. Dr. Seymour, excellent presentation. Oh, our hospital administrator has chimed in. Good morning, hospital administrator. Thank you for the information and the quiz. Rich information. I truly believe this presentation could be shared with groups and all teams in PMH. Thank you. Dr. Conleth. Excellent as always, Dr. Pinda Butler. Just throwing back inside there, family medicine. Just wanted to put that plug inside there a little quickly. Okay, okay. Thank you, Dr. Rhonda Roberts Carter. Thank you. Adderley, new doctor here. I'm always feeling exhausted, hoping it gets better. Thank you for this presentation. We have you, Dr. Adderley. We are here for you. Any additional help that you need, reach out to us. We're always here to try and guide and navigate you as you go through your internship journey and your younger years as a physician. Dr. Robinson, awesome job. Which PHA would facilitate healthy lifestyles for their workers with a gym and maybe take care life would be easier? Dr. Major, wonderful presentation. Great way to start the new year. I absolutely agree. Dr. Pinder-Butler did share the link in the chat, and I will also share the link as well in the various groups. Dr. Smith, thank you for this presentation. Hoping to retake the quiz in a few weeks with improvement. So Dr. Pinder-Butler presentation, very well received. Thank you so much. Do anyone have any direct questions for Dr. Pinder-Butler before we bring our session to an end? Great job from Samsung. Samsung, can you please change to reflect your name that is recorded at the Bahamas Medical Council? I want to remind each of you to also go over and complete the feedback survey. The link has been posted and it has been posted again. Thank you so much, Dr. Halliday. Please go and complete the survey. It's very important to us in getting out your CMEs in a very timely manner. We have to have it all together. So while it is fresh and while you are excited to tick 5 for everything under feedback, it only takes a few seconds. Just head on over to the link and complete that for us. As I see no hands for any question, I would like to take this opportunity again to thank all of you for being here for our first CME for the year 2025. We have an exciting schedule planned for you, not just in this forum, but also in the community where your family members can benefit from good, sound education as well. So continue to look out for our notices. Mark it on your calendar as we learned today. Schedule it. Schedule us in second Wednesday, last Friday. Dr. Pinder-Butler, thank you so much for a wonderful presentation. Until
Thank you
next
all.
time, guys, I will see you at our next CME. Have a good day.